Welcome to Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. So we're back with episode 3, Amber Warren here at Functional Medicine Foundations, and I'm interviewing again our medical director, Dr. Mark Holthouse. We've already talked about female health. We touched on hormonal imbalances within our female patient population, and we're now here talking about the guys. So I can't speak as much to this, but I know Dr. Holthouse, this is one of your really big passion areas of expertise that you love talking about. So we have this program called Optimal Man, and I think it's such a great name. And you obviously see more men in your patient population than I do, but they come to you. Most of them probably a little bit encouraged by their female counterparts to come and see you, right? They maybe are getting into their 30s, 40s, 50s. They've got dad bod thing going on. Their cholesterol's starting to climb. Yeah. Libido's not where it was. What's your approach? Where do you start?
So the first thing I do is kind of give them an attaboy on the back. Like, I'm glad you're here. We try to quickly get over I'm here because my arm's been twisted behind my back. Mm-hmm. My wife gave me an ultimatum, mm-hmm. and I try to win them over because that's where they're going to get the best benefit. Mm-hmm. Usually that takes about 5 minutes. Because I'm a guy, because I'm middle-aged, and because I've experienced some of the frustrations a lot of them are having, and you can kind of relate, and I kind of know what they're after. Some of them are really proactive. They've done their homework. They're aware of every podcast, aware of every YouTube. They've been to summits and webinars, and they've got a little bit of knowledge, sometimes enough to be dangerous. Sometimes they're really sophisticated and it's fun. They're motivated. So I get everybody, that whole spectrum. Kind of like I'm here because the wife told me or else. And then I've got the biohackers, that are there to stump the doctor. And I love those guys because...
And there's more and more of them coming out.
More of them. And I'm always learning from my patients. Have you heard about methylene blue?
Yeah.
The first time I heard that was from a testosterone patient that was seeking support on that. And I said, I've heard about it when I was in undergrad, and we used to use it probably to stain slides and things.
Right.
But what are you talking about in a medical context? So, yeah, you get the whole spectrum. But the way I start with these guys is literally to try to build rapport with them so that it really, guys we're very clan-ish. If they feel that I'm very genuine in the way I approach medicine, in it for them, in it for their quality, in it for optimizing their life, I get their ear, and then they're loyal. It's long gone that I was initially here because my wife gave me an ultimatum. It's like, no way, man, I'd come see this guy once a week if I could get off work. And that's my first goal, is to build rapport. Anyone acquainted with these therapeutic readiness to change stages know that if you don't have rapport, you're kind of dead in the water. People aren't buying what you're selling. And what I'm selling is a team approach to getting them back to being an optimal male. Mm-hmm. So we start with rapport. The second thing we do is I really try to work with them, and this is really part of that same issue, where they're at. Some guys are coming in that, they're already on testosterone. They're already doing HCG injections. They're already doing Clomid. They're already doing peptides. And they're doing this ester, this variety of testosterone, this day a week. And they're following it up with an aromatase inhibitor 5 hours later. And they're just like an engineer. They've got this thing Excel spreadsheeted out. And I'm saying, wow. And then we've got the guys that are coming in saying, my wife says I'm a jerk. And they're kind of looking at their shoelaces and begrudgingly admitting, I'm irritable. I don't know what's wrong with me. Yeah. I feel depressed. I've never felt so unmotivated in my life. I used to be athletic. I can't even get out of my chair.
I don't have the endurance I had.
Yeah, my stamina is gone,
Mm.
and everyone in between.
Mhm.
So I meet them where they are after gaining rapport, and then we start with these same things we talked about in our last episode with women, with the
Mhm.
Radiant Women program, with therapeutic lifestyle. Testosterone, in my experience, more than any other hormone, is influenced by lifestyle.
Mhm.
We say that there are kryptonite or weaknesses that can take pot shots at testosterone levels. One of them is stress. The other one is, and that's because of cortisol. Cortisol is definitely the kryptonite to T. The other one is sleep deprivation, poor sleep, because we, after all, secrete most of our testosterone in a pulsed dosed fashion while we sleep.
Yeah.
And it happens in a part of our sleep architecture that really it's a jealous mistress. It has to be healthy, good quality sleep,
Yeah.
not, Jack Daniels induced sleep where
Mhm.
I'm unconscious and
Mhm.
not really getting good quality sleep.
Mhm.
Um, and we talk about lifestyle and the fact of exercise as well. So
Mhm.
the right kind of exercise, the whole toxin discussion,
Yeah.
super important with the interference of testosterone. We see so many people that have phthalates, which are
Mhm.
a class of chemicals in self-care products, things that make guys smell really good during their shower without
Yeah.
incriminating any labels,
Yeah.
um, can be filled with these things, parabens and phthalates, that we know are known endocrine disruptors. Heavy metals.
Mhm.
A lot of guys that are doing indoor shooting, here in Idaho,
Yeah.
there's a lot of lead
Yeah.
that they're inhaling. And we know that lead and mercury in particular affect testosterone levels. So we talk about their community involvement. Do they
Mhm.
feel isolated?
Yeah.
Do they feel loved by their significant other?
Yeah.
Um, are they eating fast foods and just grab and go foods
Yeah.
and living on energy drinks?
Mhm.
A lot of these guys will come in and they're CrossFitting
Mhm.
to beat the band, and they're doing carnivore diet, and they're really stressed out. They're going through hard times. They're not sleeping well. They're a business owner, and they might look really good. The outer package might look really cut and really ripped until we start unpeeling the layers of the onion,
Yeah.
looking at labs and such. So
Yeah.
we always
Biomarkers.
start with therapeutic lifestyle with the guys with this program.
Wow, so you laid out a lot, and there's a lot of different directions we can go there. I think one that stands out most to me as a provider, and honestly, probably hits the nail on the head for most of our providers, is the concept of stress, right? Busyness, society. I mean, how does stress directly relate to low T, hormonal imbalances, inflammation in our men?
Yeah, just like in the females,
Hmm.
we've got this kind of hierarchy
Hmm.
where when we're stressed, we tend to make cortisol,
Hmm.
and we will do that in preference over testosterone in this
Hmm.
discussion and estrogen.
Hmm.
And so when guys have unrelenting stress, I'm not talking about jumping out of the way of the speeding bus, adrenaline surges, which we all need.
Hmm.
There's healthy and there's unhealthy stress.
Right.
It's that unresolved, I really don't like my supervisor.
Yeah.
I don't like my job. My wife and I are arguing.
Yeah.
We're having issues over finances that are just there day in, day out.
Yeah.
That's the kind of hypercortisol state
Mhm.
that brings testosterone down.
Mhm.
So we know that cortisol is a big deal from emotional stress. It's also a big deal though with chronic pain.
Mhm.
And a lot of the guys I see
Mhm.
in all ages have pain that they
Yeah.
deal with. Some of these guys are retired football players, or
Yeah.
they were jocks, and they've got back and knee issues that they're living with still.
Or they just have a 10-hour a day desk job
Work.
and they have really poor form at work, or
Mhm.
they lift poor and they don't have great form as they are trying to exercise to improve their health.
Right. Shift workers.
Yes.
They're doing jobs on a medevac chopper, or they're firefighters, or they're
Yeah.
law enforcement. A lot of them are in healthcare.
Yeah.
I'm glad I didn't know what I know now about the
Mm.
lifestyle of a resident.
Yeah.
It's like, how did I father children? I think
Yeah.
I slept 6 hours total. uh, every 3 days for many months at a time early on in residency. So, yes, sleep deprivation's part of that whole hypercortisolemic state, just like we talked about in the
Yeah.
women. So, cortisol is probably one of the strongest leverage points
Mhm.
in moving the needle towards raising T by muting that, modulating it.
Mhm.
It's hard to get guys to go do things like yoga.
Yeah.
It's hard to get
Breath
guys
work. Yeah.
off. Yeah,
Yeah.
right. They want to get home and they want to get the remote in their hand and kick back with a brewski and just like
Yeah.
watch football.
Yeah.
Um, and so that's the last thing on their mind.
Yeah.
So we try to work with where they're at.
Yeah.
What can you give me when you start your day as a tradition?
Mhm.
If you're not going to do mindfulness-based meditation activities,
Mm.
maybe you'll do a guided imagery.
Yeah.
Maybe you can use the power of a narration that's an audible thing you listen to
Mm.
that uses the power of your imagination to go to your happy place.
Mm.
And it's funny, surprising how many guys get into this.
Yeah.
And then once they start doing it, they're almost more committed than a lot of my female patients.
Mhm.
It's getting them to start,
Yeah.
which can
That
be,
buy-in.
yeah, the buy-in.
Yeah.
So I often have to show them their labs first.
Mhm.
And again, we'll do salivary testing, looking at cortisol
Yeah.
curves,
Yeah.
especially some of these shift workers. And they're like, wow,
Yeah.
that's normal. And here's me.
Yeah.
It's like, I'm making my own curve. And I'm like, yeah, you're like never normal.
Mhm.
So how can your T ever have a chance? So, yeah, addressing their stress, whether it's chronic pain, whether it's problems with the stress of having obesity, carrying a lot of central tummy fat that's driving inflammation, which is very stressful.
I'm always redefining stress for my patients. Hey, your marriage might be great. You might have a job that you love, that you can work part-time and still be a mom, but you're sleeping 6 hours a night.
Right.
Or you're taking a lot of really low quality supplements with a ton of fillers,
Mhm.
or you're on a lot of medications that are very toxic for your system, or your nutrition's really poor. You're actually not getting enough quality
Mhm.
nutrition, or you're eating too many foods that your body can't recognize. So
Yeah.
stress is not just psychological, right? Like you kind of touched on
It's
that.
all areas of life.
Yeah.
Everyone just thinks it's the I got in a fight a minute ago,
Yeah.
and it's so much more.
Yeah.
We know in the sleep discussion that guys after just 5 nights
Mhm.
of getting 5 hours or less
Mhm.
drop their T 15%. And that's in
It's
young men. That's
huge.
in
That's
young men.
huge. Yeah.
So sleep is a big deal.
So
Um,
most men, they're black or white, right? Doc, just tell me what to do, right?
mhm.
Okay, you've convinced me. I see the labs, I see the salivary cortisol. How many hours of sleep do I need? What do you tell
Yeah.
them?
Most of the data is pretty clear that 7 is kind of the magic number.
Yeah,
7 hours is a minimum.
yeah,
Um, I'm looking at sleep architecture too. Some of these new wearable devices can help us.
yeah.
The Aura Ring and some
Mhm,
of the other things on the phones and whatnot that are recording
mhm.
sleep stages are important. We know that growth hormone and things like that are secreted during these very deep stage 3, 4 delta wave sleep cycles.
Yeah.
And that things like testosterone are actually secreted during REM,
Mhm.
which is a more superficial form of sleep that is, come to find out, incredibly helpful
Yeah.
for logging in memories and learning from the day before into your long term memory. So, sleeping quality
Mhm.
and sleeping quantity are two questions that I ask all of the guys that come in for this program.
How how often or how much do things like obstructive sleep apnea
Mm.
play a role in upsetting testosterone, if you will?
Yeah, we like to say that obstructive sleep apnea is the number one underdiagnosed
Mhm.
cardiovascular disease. I see this all day long, and it's anymore in my 30-year-olds as much as it's seen in my 60-year-olds,
Yeah.
and all body types.
Yep.
Like you said earlier in our other episodes, I've seen this in 100-pound young females
Mhm.
who are this big around, and I've seen it in my big football player guys with the big neck the size of my thigh,
Yeah.
which is how we classically always thought of Pickwickian syndrome or sleep apnea. It's extremely common. It's one of the first things we look at. We know that there's an association between sleep apnea, obstructive sleep apnea, and low T.
Mhm.
We don't know exactly the relationship because it's interesting. And guys that have low T with apnea, if you treat them with CPAP, their testosterones don't always recover. So there's something else going on there.
Mm.
We do see that it's related often to the obesity and to
Yeah.
the hypoxia, the low oxygen levels
Yeah.
um, that occur with apnea. But the obstruction itself, it's unclear the relationship.
Mm.
It does seem to be mediated through a central mechanism. In other
Yeah.
words, the little messenger molecules in our brain
Mhm.
as guys that tell the boys, the gonads, to make tea, that gets suppressed when
Yeah.
we have apnea.
Yeah.
So we always look for it. There's home studies you can do, so you don't have to worry about.
Those have become so nice.
Yeah,
People, I don't our patients don't wanna go stay the night in a
they don't want
hospital.
to.
$3,000 sleep study. Yeah, these at-home ones are really affordable, really I just did one on my son, really easy to do. The convenience is great.
Great for convenience. You don't need a lot of time to get enough data.
Yep.
These guys will come in and say, I slept 45 minutes in the hospital
Mhm.
out of that whole night.
Mhm.
That was a waste of my time. And I said, you'd be surprised how little data they need
Yeah.
to get what I need.
Yeah.
But the home sleep evaluations have just made it so much easier. But
Mhm.
apnea is one of the cornerstones in working up natural, how to correct tea naturally.
I love that. Um, Something else I wanna go back because I think this is I think I'm trying to go through your list that you laid out as kind of as far as order of priorities as I can, and toxins is just up there. It just
Mhm.
is. We're bathed in this toxic soup. It's such a big deal. I see it impacting my patients' health, see it in their lab work. What do you recommend? How are you working this up? What are
Yeah.
your how are you seeing this impact testosterone levels in your guys?
Yes. Thanks, Amber. Part of the questionnaire of our program solicits their risk.
Mhm.
Do they work for a Terminex company? Are they
Yeah.
are they the termite guy? Are they the
Yeah.
pest guy? Have they been working in a plastic manufacturing facility for years? Are they a firefighter? Some of
Yeah.
my firefighters end up with the highest levels of toxins that I see
Mhm.
farming. Being an old farm kid, I really, my heart goes out to these guys.
Yeah.
We were exposed to a lot of things that we did not know were problematic back when we were kids, as farm kids. And I see in Idaho here a lot of people that are actively family farming still.
Yeah.
So we'll ask them what their risk assessment is on these questionnaires. But we know that things like these personal care products, plastics, just simply drinking out of bottles that have been sitting out behind Costco in the July heat in
Yeah.
Idaho
Yeah.
on a pallet
Yeah.
for a month, that were leaching these plastic
Mhm.
esters into the water. It gets cooled down and we drink it. We don't think it's in there, but it's
Mhm.
still in there. And
Yeah.
these things are acting like estrogens in our bodies. And so it's affecting our hormone balance.
Can you break that down? If it's acting like an estrogen, and I know as I love your workup when I see your workup on these guys, you're checking estrogen levels, you're checking DHT. Let's nerd out a little bit. Why explain that relationship,
Mm.
toxins, estrogen mimicking chemicals. Why should guys care about testosterone levels with regards to that?
Yeah, a lot of the guys come in with the man breasts. They're
Yeah.
really upset.
Yeah.
That their bra size is potentially bigger than their wives,
Yeah.
and they're feeling really disempowered
Yeah.
and demasculated, to be honest. And I'll say, look, these are these xenoestrogens that are potentially doing this to you. Some guys that are overdosing tea, that are
Mhm.
aromatizing their testosterone to estrogen, can have the same issue. And that's where having someone that knows how to balance that aromatase transition is crucial.
Yep.
But these toxins, not only are they affecting their actual testosterone and estrogen levels, they're affecting their body fat. They're
Mhm.
affecting their inflammation levels in their bodies through having excessive toxins and estrogen mimicking toxins.
Mhm.
Fertility is
Mhm.
affected. In the last 40 years, we've seen about a 40% drop
Mhm.
in sperm counts.
Yeah.
And the World Health Organization is throwing their hands up saying we have really no clue. We suspect that it might be chemicals,
Mhm.
these endocrine disrupting chemicals
Mhm.
that are lowering not just testosterone, not just promoting erectile dysfunction,
Right.
but also decreasing fertility and causing subfertility, which is just difficult fertility,
Mhm.
not just in men, but in women as well. We're seeing it on both sides of the equation. So toxins are a huge part of
Mhm.
testosterone optimization, evaluating them, looking at drug levels and metabolite levels in urine with the
Mhm.
special kits we use. and then using detox protocols to rid them specifically and bind these things and get them out of their body. It's all part of seeing if they really need a prescription the rest of their lives. I think that that's what we do better than other clinics in town, is that we're looking at the long game. Anybody can write a prescription that's got a license for this stuff, for testosterone or Clomid or HCG or what have you. I think it takes somebody that understands how testosterone works in the body within a world that's toxic, and in people that have imperfect quality of life and lifestyle practices to really do them justice.
So we know there's all these things that you've identified that stimulate aromatase. But a
Mhm.
lot of these things, you can't reverse it overnight.
Right.
Right? So
Right.
this aromatase enzyme, which is so fascinating to me still, what are things that you implement in your practice that can help inhibit aromatase, so that while we're working on root cause, we improve their libido, we naturally improve testosterone?
Mhm.
What do you utilize?
Great question. And this is really the crux of my conversation with it. It brings in kind of that cardiometabolic pre-diabetic situation to the hormone discussion, which these are my two areas that I'm passionate about.
And you're
So,
so good at them.
well, I'm always
Yeah.
trying to figure out a way to tie it in
Yeah.
because they are so interrelated.
Oh yeah.
But yes, really, you've got to take a step back and say, what makes aromatase, the enzyme that turns testosterone into estrogen, work more,
Yeah.
which is what we want to fight against,
Yeah,
right? In
right.
guys, it's central obesity, it's inflammation, which is caused by all these things we're talking about: a standard American inflammatory diet, white
Insulin. What is it?
insulin.
Still 60% of our nation is pre-diabetic with high
Yes,
fasting insulin
huge,
levels, which
huge.
your typical primary care doc isn't even checking a fasting insulin, which is usually the first thing to go up.
As
So
of
most don't know they have it.
exactly. As of 2018, the CDC statistics are that 47% of U.S. adults over 18 either are pre-diabetic or have diabetes. Almost half of us.
So
So,
sad.
and that's projected to be a majority very soon.
Yeah.
So yeah, I always tie those two things in, but it's that high insulin level of pre-diabetes that upregulates aromatase. High leptin, which is another topic, but associated with tummy fat, which is where leptin, the hormone of feeling full, comes from.
And we can check leptin in the blood.
And we can
We can
check
do
leptin.
blood testing to check leptin levels, and it's not insane expensive.
No,
Yeah.
fasting insulins and fasting leptins, as a family practitioner, I never used to do that.
Right.
As an integrated practitioner, we do that as part of the routine workup because so many of them are elevated. Having insulin resistance, having leptin resistance, which is stimulating that aromatase, is tied directly to inflammation that stimulates aromatase. Being low in vitamin C, being low in zinc, upregulates things like aromatase.
Again, all things we can test
These are
for.
lifestyle,
Yeah,
right?
yeah, and their
Lifestyle
lifestyle,
things.
yeah.
Chronic stress, lots of cortisol. These are the things, and BPA, plastics, are known to upregulate aromatase. Things that decrease it, kind of the antithesis of that can keep our T, are going to be just the opposite of that, having a loss of that tummy fat, anti-inflammatory, antioxidative diets, decreasing pre-diabetes and insulin levels with intermittent fasting,
Yeah.
with peptides,
Yeah.
with time-restricted protocols, reducing cortisol in all the ways that we've been talking about, with good sleep, better diet, um, managing chronic pain, which we often forget to do.
Yeah.
On average, when a man enters his 40s, noticeable changes begin to take place. Declining hormones make it difficult to sleep, harder to lose the tad bod, anxiousness, low libido, lack of motivation to pump iron, and more. Men in their 40s start to lose up to 8% of muscle mass every decade. Don't be most men, and don't be a statistic. Men, it's time to take control of your health. Our men's health experts at Functional Medicine Foundations have put together a brand new Optimal Man program to boost testosterone and optimize health in men. This program also includes an online private group with other optimal men on their journey for support and accountability. Men, it's time to make a change, a positive change. Don't be average, be optimal. Learn more at fundmedfoundations.com/optimalman.
Yeah.
Managing dysglycemic, the problem is when you've got this pre-diabetic patient who's having 10 o'clock sugar that's just dropping into the basement for a few years before they declare themselves as full-on diabetic, those people have got high cortisol, high insulin. Everything that drives aromatase is going to make their T that they have become estrogen more predominantly. So we really look at all of those elements on an enzyme basis. The other side of that question is the other way that testosterone gets stolen. We call these the thieving enzymes of testosterone, aromatase. There's another one, 5-alpha reductase, which is, again, a little geeky, but hold on with me. We're going to bring this back and make it real. The 5-alpha reductase, not unlike the aromatase, steals your reserve, your pool of testosterone, and it takes it down to another metabolite. In this case, it's not the estrogen, but it's the dihydrotestosterone. It's a very active form of testosterone that happens to be incredibly potent, and you only need small amounts of this stuff to do what you need. Too much of it, and you get problems like hair loss and great big prostates, and maybe things like acne. So we're always trying to modulate, not shut down completely, aromatase and 5-alpha reductase. And it's ironic that the very same things that upregulate aromatase that we mentioned earlier, most of those same things upregulate this 5-alpha reductase enzyme. So,
and we can check DHT in the blood as well.
DHT is just a simple blood test, and if it's going down a pathway where you've got too much what we call androgenization, yeah, these guys grow ginormous prostates and they have male pattern hair loss. And so whenever we see guys with overdosing of testosterone or testosterone being given and no one's paying any regard to the downstream drift, we call it, on how these enzymes work, often they've got crazy high levels of DHT and crazy amounts of estrogen. So, and those things in too much, in too high levels are deleterious to guys' health. So dealing with the high blood sugar, dealing with the blood pressures, the inflammation, the stress, directly inhibits those two enzyme pathways to keep your T.
How about supplements, botanicals, where we can also calm down those enzymes and help hold on to the testosterone? I know there's a lot. What are some of your favorites?
Yeah, there's several enzyme systems that will help with really hormone metabolism, and things like hops extract and rosemary and indole-3 carbinol and some diindole methane. Some of these molecules that our bodies make that you get from eating things like broccoli seeds, broccoli seed extract, can be incredibly helpful for determining which way testosterone is getting metabolized. I always talk about those as kind of a secondary effect. It's those lifestyle effects that have the biggest impact. That being said, there are some things that we can use in the natural world that can naturally raise T that can help. There's a lot of buzz out there about Tribulus terrestris. Really not a lot of data that supports it raising testosterone serum levels. There's good data that it can help with sperm and semen quality, not so much testosterone itself. The things that have the best data as far as naturally raising T in the botanical world are probably ashwagandha and something called mucuna. There's something called longjack. These are all botanicals that have great data on improving not just sperm quality, but raising serum total testosterone levels as well. But I use those as kind of a last recommendation because my experience has been that they're kind of minuscule players
to these lifestyle
changes.
I tell a lot of my patients, I can spend a lot of your money. We can recommend all the supplements in the world, but they won't work if we're not sleeping, if we're not in community, if we're not putting good quality, nutritious, organic foods into our bodies, right? So yeah, it is absolutely foundational.
Yeah.
There's one biomarker we didn't touch on that I know is part of your workup in your guys, SHBG.
Mm-hmm.
I
Yeah.
find that pretty significant when I'm working up my guys for hormonal stuff. Can you speak to that a little?
Yes. Sex hormone binding globulin, SHBG, is a liver-produced hormone that is or a protein that chaperones the hormones, in particular testosterone and estrogen. Progesterone kind of has its own thing, chaperone molecule. And the idea being that we know these sex steroid hormones are like oil, and oil and water, which the blood is like water, don't mix. So they have to have a detergent, what we used to call in biochemistry a micelle, something that will help them kind of mix and be okay together. Or they've got to have a transport mechanism. So that transport mechanism for estrogen and testosterone is SHBG.
Mhm.
And come to find out, there's really good data now showing that there's a direct correlation when SHBG and total T, testo, are low, that there's a much higher risk of getting metabolic syndrome and prediabetes. So SHBG now has come into its own kind of its heyday. It used to be marginalized as just this carrier thing for hormones. And that matters. We're going to talk about that, which really answers your question more directly in a minute. But it has its own independent risk factor apart for prediabetes and metabolic syndrome
How
in its own
interesting.
right when it's insufficient.
Mhm.
The SHBG discussion gets a little convoluted because it's a little different conversation whether you're talking about women or whether you're talking about men. When we're talking about men, we'll keep this simplified. We want less of it
Mhm.
so that the testosterone that's circulating around in our blood is more bioavailable. It's not bound up
So
to
that's
sex hormone.
represented by the free testosterone.
That's
Total's a great number to look at, but the free is actually what's bioavailable, unbound by this SHBG, right?
that's right.
Okay.
That's right. And so many of my guys who've had work done
Mhm.
come in having their primary care physician only having looked at it total.
Yeah.
And the total testosterone, if the sex hormone binding globulin is elevated, can really misrepresent the true circulating bioavailability of T. So free T is a huge deal.
Mhm.
But in guys, we're trying to optimize testosterone, so we want less SHBG
Mhm.
around. In women, not so much, because when there's less of it around, there's more estrogen that's free and estrogen dominance in that whole discussion.
Yeah.
So it's not quite the same issue with them. Things that will help that will help with your SHBG not being too high are going to be things like nettle root,
Mhm.
like omega-3 fish oils.
Mhm.
There's some data that of some other things as well. But my more pragmatic guidance with diet and how that fits into this whole discussion is really probably the most relevant
Mhm.
topic with lifestyle and SHBG, and that is low fat and low protein.
Mhm.
We know that low fat diets, low protein diets, veganism, vegetarianism is associated with higher SHBG levels. And there's studies now showing that the higher that SHBG is, the lower the free available
Mhm.
T is. So a lot of those guys, I'll try to introduce other forms of protein, especially my older guys. You know, they tend to sometimes forget about protein or they're eating not enough fats.
Right.
You know, and I'll get them on avocados, seeds, nuts, good oils.
Mhm.
It doesn't have to be animal fats.
Well, and I find, intermittent fasting, especially for our guys, because we don't have the same premenopausal issues with the younger patients. It's such a great tool, as you've described, for so many of the reasons to naturally increase testosterone. But I find a lot of my patients that start this intermittent fasting and love it, all of a sudden they're limiting the amount of fat and protein they're getting in, which, as we're learning from you, can have a lot of effects on
Yes.
testosterone.
Yes.
So
Yeah.
it's not always that with an intermittent fasting regimen, you teach this really well. It's not always that we're eating less. Our macros are going down. It's just we're shortening that eating
Exactly.
window.
Yeah, exactly. The work that Walter Longo's done at
Mhm.
USC
Mhm.
on mirroring on rat and mouse models now has been reproduced in humans,
Yeah.
and it's really clear that it's it's the isocaloric, same caloric.
Yeah.
Uh, that's the issue. We're taking that same number of calories and just squishing it
Right.
into that smaller window of time.
Right.
The data, and there's stuff from Harvard too. Dr. Stephen Finney out of UC Davis, Jason Fung, Toronto nephrologist, have written extensively on this. How it's that window of time, not the amount of calories that matters. And in fact, we know from the Biggest Losers television studies, we went and looked in the Obesity Journal, published in 2016, that even 6 years out from that event, people's metabolisms were permanently altered and they were much slower. So caloric restriction, where you limit the number of calories per day, doesn't have the same effects as taking that same number of calories and instead of eating it over a 12-hour window, eating it over an 8-hour window. We were talking in the last episode with women and stress and cortisol premenopausally with intermittent fasting. And one of the things we emphasize is, look, we know a 12-hour fast helps. Anything you can do to lengthen the amount of time where you're not putting anything in that obligates us to raise insulin allows us more time during a 24-hour period to burn peripheral fat.
Yeah, I love that. Yeah.
Same is true with the guys.
Yeah. Just really cool data that I think is coming out even more recently on how we can use that as a great resource. We touched on this in the women. Really exciting stuff we're doing with peptide therapies. How are you using peptides and what benefits are you seeing in your male population?
Yeah, great question. This is kind of the latest thing to what I'm offering. I've been doing hormones for years. Peptides are kind of the new kid on the block.
Yeah.
We're trying to learn as much as we can and discover compounding pharmacies that are making these great products for us and great combinations of products that are synergistic, that support the effects of growth hormone without giving growth hormone.
Right.
I would never feel comfortable giving guys growth hormone, not just because of legality issues, but because of the known cancer risks and other things that go along with that kind of therapy. We know that the peptides that help release and have a growth hormone-like effect are very different than giving growth hormone itself. But yes, I talked about a little earlier the counter-regulatory response when we intermittent fast is to raise glucagon, raise cortisol, raise growth hormone. And growth hormone is this beautiful hormone that starts to unfortunately decline in our 30s and really takes a dive 40 and 50s, that promotes leanness and inhibits having an accumulation, lipogenesis of fat in our bodies. So as that wanes, it really does promote this inflammatory, premature aging, cellular senescence that we talk about. So peptides are a wonderful way to dose in the evenings and sometimes even again in the morning to support the effects of growth hormone like that. Not just with body composition, but also with regenerative health, for tissues, for recovering from a workout. So you start optimizing testosterone along with optimizing the effects of growth hormone in a safe way. It's far more effective synergistically. Not everybody needs both.
Right.
A lot of them don't need them at all. And again, a lot of these guys that take seriously the therapeutic lifestyle stuff, they do just as well. But gone are the days of looking at trying to optimize the molecular effects of these hormones to those of just short stature. And now that we have ways that we can do this safely, it's really exciting.
Yeah.
So you can optimize their body comp, their recovery, their detox, their aging, their immune. We haven't even touched on that. The immune system support that we can find with these same cell signaling molecules that our cells use, and they kind of just stop producing. It's wonderful to have that knowledge. Again, it's in its infancy, and it's bringing personalized medicine where we can say, here are your labs, here are your unique concerns with your body, your risks. Let's stay away from this group. Let's tweak this one. Pretty exciting time.
Yeah. I love to see new modalities come out for like you said, really safe, evidence-based regenerative medicine, right? We're kind of expanding into this field within functional medicine where now we're as kind of functionally trained practitioners, this whole concept of regenerative medicine and how it can really add to the foundations that we've already been doing to our patients. It is really cool stuff.
It's kind of a natural progression that
It
I think
is,
we needed
yeah,
to make.
for sure.
We spend so much time studying mitochondriopathies and the mitochondria, which really dictates a lot of how the cells age.
Yep.
And these other organelles within the cells. It's molecular medicine at this point, and
Yeah.
peptides are at the forefront of that.
Yeah.
And to be able to understand that there are stages that the cells go through where they're trying to recover from a stress,
Yeah.
that we need to be respectful of where they are in that phase, that stage, the so-called cell danger response.
Yeah.
You can't just overmethylate people with B vitamins as they come in the door, one size fits all.
Or give everyone a ton of curcumin to get their inflammation down, right? It just
Exactly.
doesn't always work.
Yeah. Sometimes inflammation is exactly what the body needs.
Yeah.
It's knowing how to determine where it's starting to become deleterious, I think, is where all the wisdom is.
Mhm. I like to end each one of my discussions, and this has been a phenomenal discussion. I've learned a lot. If there's as a physician, if there's one piece of advice you offer to your patients that makes the most dramatic impact on their health, what is it?
Mm. Yeah, I'm famous for being quoted and saying that it's the human touch, and I've always got to go there to be true to myself.
Yeah.
After doing this for 30-something years, the biggest piece to seeing results is that rapport,
Mhm.
is that caring,
Mhm.
is that, oh my gosh, I have somebody sitting in front of me who's actually listening to what I'm saying,
And trust. Trust goes a long way.
right? That still is always my number one. I think it's the combination of high tech and high touch.
Mhm.
If they see you care and they see you're competent and you're skilled in an area of biology that's practical, that's applicable, that's looking out for their optimization within the context of safety,
Mhm.
they realize they're somewhere special, and that's what does it.
Well, that's pretty much you in a nutshell, Dr. Holthouse. I know I
Oh,
speak for a lot of your
yes, thank
patients when
you.
I say that.
Thank you.
Well, thank you for being here. What an exciting conversation, exciting direction we're going with Functional Medicine Foundations.
My pleasure. Thank you.
Thank you. Thank you for listening to the Functional Medicine Foundations podcast. For more information on topics covered today, programs offered at FMF, and the highest quality of supplements and more, go to funmedfoundations.com.